So we need to be more authentic with each other. How do we do that?
A lot of it is just being truthful, being authentic.
Dr. Hardy, our theme here is life, health, and of course healing hope.
No, I'm not going to do it. I said, why? This is fantastic. This is an amazing.
There is a solution.
One part of who you really are. We're spiritual beings, all of us. Whether you believe in God or not, you're a spiritual being.
Thanks for joining us for this edition of Healing Hope from the Kettering Health Network. Today we're going to talk about intersections. And no, we're not talking about traffic. We're talking about what happens when the gospel meets health care, and what happens when a healthcare provider meets the gospel. But first, here's Lonnie Melashenko and Dr. Becky Wong.
And we're absolutely delighted that you've joined us again today on Healing Hope, because today's subject is particularly apropos for what's going on in the whole health world today.
I think it's astounding how, I would say probably in the last 2 decades, before, when people were all excited about technology and the latest robotic procedure or a brand new medicine, now they're saying, despite all that, the human being, when they get sick, still needs compassion. They need someone to care about them and to dig deeper. What's really behind the chest pain, the severe headache?
I am so excited about the fact that so many of these previously, we would say, non-religious based hospital healthcare providers are now coming full circle and recognizing the importance of spirituality in medicine.
I think that hospitals, in a way, did, because most hospitals, well, all hospitals have a chaplaincy service, because they realize that when someone's very ill or they have a dying family member, then they want to turn to their priest or their pastor. But what's really new, Lonnie, is that now physicians and nurses, for the first time, are recognizing there is much more to health and disease than medication and surgery and technology. In fact, Lonnie, medical schools, there are about 125 in this country, and fully 35% of them have some component in teaching the first and second year medical students about how to take a spiritual history. It's not just enough to know what did your father die of, what did your mother die of, what diseases run in your family. Now we need to know, have you thought about your relationship to God? Have you thought about dying? What are the things that bring meaning to your life? And some of these questions that never before would doctors or nurses ask their patients that. It's important.
And many of these secular medical schools and medical hospitals are now having what they call spirituality in medicine, instruction and training, and part of the preparation of doctors and nurses and allied health care providers. I'm looking at Duke University, particularly Georgetown University, even Harvard Medical School. Spirituality in medicine comes right around full circle from what the great physician himself prescribed to John in 3 John 2 on that island of Patmos probably. Beloved, I wish above all things that you would prosper and be in health even as your soul prospers. So you've got the psychological or the emotional, the physical or the medicinal, and the spiritual components. And we call it today something like holistic medicine, don't we?
I think it happened because you can take 5 people that have the same type of cancer, and you can put them through the same regimen of chemotherapy, radiation, surgery, and then you can say, why do 4 out of the 5 survive to the expected survival, 10 years out, and they're free of disease, let's say, but why does one live 20 years? What made the difference in that 10 years extra of life? And it probably is in the realm of hope, faith, love from family, from God, that makes a difference. And that's why there are medical schools. Duke has been a leader in doing research in what is making the difference that certain people are healthier that have exactly the same risk factors for disease and the same diseases, but they do better.
Dr. Wong, as a physician, there's some things you wanted to share with our viewers about today's topic in particular.
That's right, Lonnie. Here at Healing Hope, we often focus on the close relationship between faith and health. We know that God wants us to be whole in body, mind, and spirit. They are so closely intertwined that when any one of these get out of balance, it impacts all the other parts. This simple but profound fact formed the foundation of two pioneering approaches to health care that were born before the turn of the 20th century. On the one hand, Dr. Andrew Taylor Still, a Missouri physician, pioneered osteopathic medicine. While recognizing traditional medical techniques, he developed a more holistic approach by stressing wellness and prevention through healthy diet and exercise. During the same time period, Dr. John Harvey Kellogg, a Michigan physician, and Ellen White, visionary founder of the Seventh-day Adventist Church, revolutionized the understanding of health and disease by promoting the use of fresh air, sunlight, exercise, a vegetarian diet, and other natural remedies such as hydrotherapy. Allopathic physicians are known as MDs, or doctors of medicine, while osteopathic physicians are known as DOs, doctors of osteopathy. Other than those designations, their medical school education, residency training, and licensure are equivalent. In 1999, Kettering Medical Center, an Adventist healthcare institution, and Grandview Medical Center, an osteopathic teaching hospital, joined together to form the Kettering Health Network, combining allopathic and osteopathic care in a faith-based environment. Lonnie recently had a conversation with Dr. Thomas Hardy, the Vice President for Medical Affairs at Grandview Medical Center, about whole person care, faith-based care, and the difference God makes in individuals' lives.
Well, thank you so much, Dr. Tom Hardy, for interrupting your busy schedule, big hospital in the state of Ohio, to come here in our studio.
Well, thank you, Lonnie. A pleasure to be here.
I suppose a little time off is okay once in a while, too.
I enjoy it. I enjoy it very much.
Now, some time ago, you wrote an article about the similarities between osteopathic medicine and Adventist health care. Were you surprised by what you found when you wrote that article?
I was. My boss told me on a Friday night he wanted me to give him an article on Monday outlining the similarities between osteopathic medicine and Adventist health care. And I was starting at zero. I really didn't know much about Adventist health care. I had just joined the Kettering Health Network. I was just beginning to learn what being an Adventist was all about, not being one. And as an osteopathic physician, I was curious about why he would want me to explore this. So I did some research, and I was astounded to find so many similarities. The first one that really jumped out at me was that Ellen White and Andrew Taylor Still were contemporaries. They were born almost the same year. They died in almost the same year. And both of them left a tremendous legacy, which exists today. More interesting, I think, is the fact that those two legacies have come together in Dayton in a unique way. I don't know of any other joining of osteopathic medicine and Adventist healthcare anywhere in the country and anywhere in the world. And when we began this journey back in the year 2000, I think there was some uneasiness on both sides about the marriage. But the article helped me to understand the similarities between what Ellen White was trying to do and what Andrew Taylor Still was trying to do. Their lives were very similar in some other ways. I think both Ellen White and Andrew Still came to this appreciation of what God wanted them to do through some trials and tribulations in their life, and particularly with people who were very close to them. Ellen's husband, as you may remember, was not doing very well. Andrew Taylor Still lost 2 children to meningitis. And both those events were seminal in the formation of their idea about how healthcare could be delivered. Remember, in the 19th century, we didn't have the tools we have today. We were using little bits of strychnine and occasionally bleeding people, leeching and things that today probably wouldn't fit into my armamentarium. And they both saw that the body has this inherent capacity given by God to cure itself if you just leave it alone, or Better still, if you help it with good food, clean air, clean water, exercise, no alcohol, no tobacco, those things today which are supported by rooms full of research, in the days of Ellen White and Andrew Taylor Still were revolutionary. Both of them carved out a unique place within medicine as a whole within America. And their emphasis has been not so much on interventions and doing the procedures and things that are so much a part of medicine today. Both of those movements tried to prevent people from getting to the point where you would need that.
And would it include this idea of holistic health? And explain that to maybe some of our viewers who don't understand. Yes. What is holistic medicine?
What both of these movements try to do is to teach the providers that the disease does not exist by itself. If you have diabetes, for example, it exists within the body of a person, and that person exists within a family and within, to a larger extent, within the community. And that disease affects all those things. So when you care for people, you have to be mindful of the mind, body, spirit connection that they have, and not just address the blood sugar, but address the impact on the person's family, on his job, even on his spiritual life that the disease may have. And that's really the essence of holistic health care.
Now, as a Christian physician, one of your concerns is to meet the healthcare needs of the poor. Tell me about your work at the Cassano Health Center.
My wife says that working there has transformed me more than any other thing that I've done since she's known me, which has been over 20 years. And it has been an almost religious, transcendental experience to, first of all, meet people that we don't meet in our ordinary day-to-day life. This is a group of folks who are underserved in our community, and they exist not just in Dayton, but across the country. Folks who have significant disease, but really because they have no insurance or they're in low-paying jobs, have little or no access to health care.
And that would include dental care, too.
That would include dental care. It also includes mental health care. Remember, when we talk about what we do within Adventist healthcare and osteopathic medicine, we consider the whole patient. Cassano is unique in that it addresses all of those needs. It's the only place in the community where somebody who is uninsured can come and get their spiritual, their mental, and their physical issues dealt with under one roof by a very caring staff.
And are they qualified staff? Are these just sort of interns, or is this full-fledged medical care?
It is an osteopathic training institution. We have the family practice residency program there, but we also have 10 other specialty programs there: general surgery, orthopedic surgery, cardiology, nephrology, neurology, specialties that this group of patients that we're caring for would have no access to anywhere else in the city of Dayton. And it makes such a difference, not only in my practice as a family physician, but in the lives of people that I care for.
We'll have more with Lonnie Melashenko and Dr. Thomas Hardy after this brief break.
Over a century ago, a brilliant young Dayton inventor had a vision for the future.
By itself!
You know, this Kettering guy just might change the world.
Today, that same spirit lives on at the Kettering Medical Center Network, bringing the best in medical technology from around the world home to Dayton. With that kind of vision for the future, what might tomorrow bring?
Those guys just might change the world.
You can only imagine. The Kettering Network, for life.
If I'm going to be a healthcare provider and if people are going to come to me and trust me, then I want to give them the best care that I possibly can.
I love it. It's great. The classroom sizes are awesome. You get that personal one-on-one time, even in class.
They taught well, and I learned well, and they really truly cared.
The philosophy of Kettering College of Medical Arts is such that our view of who we are as people means that when we care for others, we are doing the work of God. We are God's hands.
It was just so surreal to me because I didn't ever think I had a heart problem. You know, here I was 47 and they said that, I probably had about a 1% chance of making it. And I did. Kettering is known as the heart hospital, and when I see Kettering, I think that's where I got my second chance, and it feels like home.
For more of the story, go to experiencekettering.com. Kettering, for life.
I knew it was serious the whole time, but it was still just unreal, and you never really soaked it in. So I was hearing all this stuff, and it sounded really bad. You can't even tell that she went through such a crisis because she's back to normal, and they said she'll eventually feel better than she did before. So I don't think they realized that they not only saved my mom, but it helped save my family.
For more of the story, go to experiencekettering.com. Kettering, for life.
Welcome back to Healing Hope. Now we rejoin Lonnie Melashenko and Dr. Thomas Hardy.
What inspired you then to become a physician?
I tell the medical students when I get to talk to them each year that I'm the least likely guy in the world to ever have become a physician. There was nothing in my early life. I'm not a fellow who knew in first grade he wanted to be a physician. I didn't know what I wanted to be. When I graduated from college in 1966, I was commissioned as a second lieutenant in the infantry. And there was a war going on at the time, and I went...
We're talking Vietnam War.
I had 2 tours in Vietnam as an infantry officer, as a combat officer. And frankly, I didn't expect to survive. And when I did, I came back and I'd had an experience in Vietnam. I got hepatitis, and I was in the hospital for about 6 weeks. And because I was an officer, I got a double room. I didn't have to stay out in the ward with hundreds of other guys with hepatitis. And my roommate, oddly enough, was a surgeon from the Cleveland Clinic, Cecil B. Esselstyn III, a great guy. I was 22, he was 32. He looked real old to me at the time. But he was a great guy, and he talked to me, asked me one time if I ever thought about being a physician, and it hadn't entered my mind. And he said, I think you might be pretty good at it, Hardy. Still didn't click with me until one time in Vietnam I saw what was called a Medical Civic Action Program, a MedCap. They'd come to a village. We had secured the village to make sure that the Viet Cong were out. Helicopter landed, a dentist and a doctor and a nurse got out and began to hold sick call for these villagers in the middle of nowhere. And I looked at them, and I'd been in Vietnam 18 months, and in that 4 hours, I saw them do more good than I'd done in my 18 months. And I think if I look back on what event triggered this journey to being a physician, it was probably that day. Because sitting here talking to you, I can still remember standing there, M16 slung over my shoulder, watching these guys work and thinking, that is pretty cool.
Dr. Hardy, our theme here is life, health, and of course healing hope. Your experience in Vietnam, how did that affect your perspective of life and actually your view of God?
You know, one of the great questions I've always wrestled with is, if God is all good, whence cometh evil? I thought about it in college because I was going to be a minister, and you always have to answer that question to non-believers. You know, if you tell them how good God is, they'll say, well, why did Hitler come into the world? Why is there all this evil in the world? I didn't have a good answer, and I went to Vietnam, and I came back with more questions than answers about that. And it did profoundly affect my view of the world and of life. Seeing, you know, so much of death, I think makes one value life even more. And when I came back, I spent probably 15 years just wandering around. I went to medical school, I did my residency, but I really didn't have the Lord in my life until much later. And having children, I think, brought me back a little bit. And honestly, in this last year, since I've been going to church with you, it has transformed my life dramatically. And I've tried, now that I think that I have come back into the fold and am more guided by the Lord's will than I was before, act that out and trying to demonstrate that in my life toward my patients and my fellow physicians and the people I work with.
Well, more specifically, how has this affected your hopes for your patients as you serve them and administer medical practice?
Being in a faith-based organization as a physician, I think, makes a big difference. I think that we have been blessed to become part of the Kettering Health Network. There was some angst in the beginning when the osteopathic hospital and this Adventist organization that had been separated for years in the same town finally came together. But I think in part, like in arranged marriage, we have not only learned to live together, but to honor each other's traditions and to use those traditions to strengthen ourselves. People who come there who are strangers who've never been to our organization before, who may join us in a meeting, a consultant, for example, comes from New York City or Los Angeles, will come in and we explain to them that we always begin our meetings with a word of inspiration and a word of prayer. And it never fails to impress them. These are people that travel all over the country. I know they've been in big organizations, but there's just something about that moment, 5 little minutes at the beginning of a meeting, which just seems to set the tone for the entire meeting.
Faith-based care makes the difference.
It makes a huge difference. It's not unusual for a member of my staff to pray with a patient, particularly those who are upset, a bad diagnosis, completely out of resources, unable to afford anything. They just lost their house, they lost their job, their son or daughter just got put into jail. I mean, all those things happen in this clinic, where I work from time to time. And the faith of the staff, I think, makes a big difference.
Disarms the apprehensions and the fears and maybe anger.
It does that, but it also gives people a sense of hope. I think that one of the things that being a Christian does is no matter how bad things get in the world, you have a sense of hope because you know that you're not alone. And that's the message that we try to give to the people who come to Cassano. No matter how desperate you are, no matter if I have to give you a bus token, which we do, to get home, and another bus token to get back for your next appointment, you know you're not alone, that you've got this clinic, which is part of a much larger faith-based organization whose heart is in making the lives of the people in the communities that we serve better, not just their health, because being healthy is a function of a lot of things, more than just being me as a physician. There are many determinants of health, and an important one is this spiritual dimension of folks that we too often ignore in medicine. Being part of a faith-based organization allows us to act on that and to demonstrate that in the lives of the patients that we care for. And I find myself more and more telling them at the end of the time, once we get the medications and the appointments and everything straightened out, I ask them, do you go to church? And inevitably they say no, or I used to. And so I sit and just take a minute. I'm not proselytizing. I'm not trying to convert them. I'm just trying to tell them that from what I know of their life over these past months of seeing them, that there is something missing. And I tell them that there was something missing in my life. And I think that finding that something might be very helpful to you. And so I suggest if they go to church and they need some help finding one, I'd be glad to do it. And I think they're also always very appreciative of that. And I think those patients who have a spiritual dimension to their life are much better, no matter what their condition is, than those that don't. I think people are. I know I am personally as a physician, a kinder, gentler person now that I'm where I am with the Lord than I was in those years when I wandered around. I know it, and everybody who knows me knows it as well. I have friends who
Ultimate
say,
extreme makeover.
Yeah, it was. Move that bus, and there was Tom Hardy on the other side who literally been born again.
Thank you so much for joining us today.
My pleasure. Thank you very much.
We'll have more Healing Hope after this brief break.
They actually do care about your progress. I know, when I heard that I said, yeah, okay, you hear that from a lot of schools. No, really, we do care about your success.
When I go home, I talk about Kettering because I've had such a great experience here.
If you have a commitment to going into healthcare, you're going to get there in a setting where you know your fellow students and where you know your teachers, and it's going to make you someone who I think is going to be really highly valued in the workplace.
Never again just take anything, the perfect pregnancy, for granted, because you just never know. We were 4 weeks to the day early. I immediately was just like, we can't do this. We're not ready, you know, he's not ready. The special attention there was from the get-go. And so I knew he was going to be in good hands because it was their child, in the sense that the comfort was just there.
For more of the story, go to experiencekettering.com.
He smiles all the time. He's just, you know, thriving. Loves his mommy and daddy.
It was just so surreal to me because I didn't ever think I had a heart problem. You know, here I was 47 and they said that, you know, I probably had about a 1% chance of making it. And I did. Kettering is known as the heart hospital, and when I see Kettering, I think that's where I got my second chance, and it feels like home.
For more of the story, go to experiencekettering.com. Kettering, for life.
I knew it was serious the whole time, but it was still just unreal, and you never really soaked it in. So I was hearing all this stuff, and it sounded really bad. You can't even tell that she went through such a crisis because she's back to normal, and they said she'll eventually feel better than she did before. So I don't think they realized that they not only saved my mom, but it helped save my family.
For more of the story, go to experiencekettering.com. Kettering, for life.
Thanks for joining us for this edition of Healing Hope from the Kettering Health Network. In our next edition, Lonnie is joined by Chris Vandenberg, who will discuss a quiet revolution that has been taking place to extend the healing ministry of Jesus in practical ways through faith community nursing.
Because, you know, churches is where medicine began. It was the deaconesses that cared for people. The churches were the places of healing.
Well, you go back to the Old Testament model, you went to the priest.
That's right.
He determined whether or not you had leprosy or not.
And whether or not you were cured.
Yes.
But we've gotten away from that. Over the years, we got further and further away from that until we got to the point where people were looked at totally as their physical ailment and not as a whole being at all.
And Dr. Becky Wong will explore the connection between fiber in your diet and weight loss. See you then.